Today on Leaders in Healthcare, Jason Morehouse is a mental health advocate pushing to increase the diagnostic speeds within healthcare. Drawing on his experiences and frustrations as a patient, he is now the founder of HiBoop, a digital patient engagement tool helping to rapidly screen people for complex and multi-morbid psychiatric diagnoses. Tune in to hear his personal story and how HiBoop can help save your patients months or even years of ineffective treatments and incomplete treatment plans.
I always had, quirky anxiety and just figured that's who this human is and just, kind of deal with it. I don't have a GP, so as many of us don't. I just wandered through life like a firefly.
Problem is just like lack of access to diagnostic.
I just felt there had to be a better way than just dealing with this. I need to figure this out because I'm responsible for my family and the business. Everybody's out misdiagnosing themselves online. Okay, so all of these things are connected. But every time I go to the walk-in clinic, I get an SSRI for anxiety. The whole point with HiBoop is like we can accelerate this with modern technology where people can get additional help versus continuing this cycle of like, what is wrong with me?
Today, we're talking to Jason Morehouse, a little bit more around his personal experience in the mental health side of things, and then, leveraging that experience to try and improve the system and actually come up with some patient-facing tools. Jason, thank you so much for joining us today.
And thank you for inviting me. I'm super excited to at least share my side of it and what we're doing at HiBoop.
Well, how did you get started with things? I guess if we dial back the clock a few years, what was your own personal connection with mental health?
Yeah, I mean, it's something I've been aware of and grew up with it in my family as many people do. Not in back then it was less understood, not even just stigmatized, which I guess both go hand in hand. I just kind of went through it on my own and really it was in my mid 40s that I really even get diagnosed with anything at all. So I just wandered through life like a firefly. And I've got 3 kids and I've been relatively successful, so I'm not complaining, but there is some injustice in the way that we're kind of dealing with mental health, be it shared capacity. That's, a big thing, not just in Canada, but also around the world, and even just access to the beginning starting points. And that's what we do at HiBoop.
I mean, that seems to be the often cited initial problem is just lack of access to diagnostics. I mean, what was it that was causing the roadblock for you, or why did you feel like it took so long?
I mean, I don't have a GP, so as many of us don't. For me, it was always I always had quirky anxiety and just figured that's who this human is and just kind of deal with it. Everybody's got anxiety, but for me, it was getting debilitating for sure. So I'd go to the walk-in clinic and they would do what they could within this short amount of time that they had. But it just never worked. It was still there, and then it was later on, which I was like, look, I need to figure this out because I'm responsible for my family and the business at that time. So yeah, I spent a whole bunch of money and got 4 diagnoses, and I was like, nobody can really afford this. Mine was generalized anxiety, ADHD, which I was like, that makes sense now, and to everybody around me, they were like, we knew that. I was like, why did nobody tell me? Complex PTSD, and then some carry-outs. So I just felt there had to be a better way than just dealing with this. The whole point with HiBoop is we can accelerate this with modern technology, not to replace caregivers, but to accelerate the time it takes to even get clarity on a starting point. And everybody's out misdiagnosing themselves online, through whatever portal they think they need to be in. And it's unfortunate.
Well, it's so important to get that accurate diagnosis because like you mentioned, right, if you start barking up the wrong tree, that can waste months or even years of time, right? And it certainly is reasonable. Start with, okay, go lay on a beach for a little while, right? It can be tough to tease those apart. Is this burnout? Do I need to just take a little bit of a break and have some more balance at work? Or is this starting to be pathological anxiety, or is there more than one thing at play? And again, it's critical to like get that dialed in. Otherwise it becomes a bit of a like, okay, is what we're doing helping, or is this treatment resistant, or is it just off the mark entirely?
Yeah, absolutely. Sometimes it's physical, sometimes it's environmental, all of the things that we kind of know. So we're basically just taking the existing science, which again, we know is not perfect, DSM and all the things to start to connect those, what we kind of call constellations. So, okay, here's a starting point, but this question actually, maybe let's look here. It's what an amazing doctor would do anyway. But with capacity issues, is then to be like, here is a preliminary assessment. Maybe you just need to go on a vacation or get a cat or something. But here's the critical things that we will either track or deal with. And that's basically what we're doing, is giving the care providers that first starting point. So let's say somebody goes into a treatment center for whatever it might be. It could be an eating disorder. Somebody's paying for that 6-8 weeks, sometimes longer. But that first week is critical. Right? That first week is intake and stabilization. And then, then they start to hopefully dig around about what is driving that symptomatic coping mechanism. And then you got 4 weeks left. So we're just trying to get ahead of it. Even if that care provider or that clinician or that treatment center they don't deal with, say, bipolar or something. Well, at least there's an outtake where people can get additional help versus continuing this cycle of like, what is wrong with me?
When it comes to that sort of, higher intensity or like the treatment center process, like what parts of that did you take and then try and incorporate that into the technology, into HiBoop, and replicate that to make it more readily accessible?
Yeah, so I had to, I don't think I'm oversharing here, but I'd pay like $80,000 at a holistic treatment center here in the island just to figure out what was going on. And they did an incredible job. It's a beautiful place. I would frankly live there, but it was kind of like, well, okay, so what are the tools that I was very curious of technology, and we did some psychometrics and stuff like that to start to guide the doctor at that point to figure out, right, let's map your programming, your education, your prime therapist, whatever it is. And so after I'd kind of wrapped that up, which was a couple of years ago now, it was always in my head there has to be a better way. And we're in almost 2025, and we're still using a filing cabinet of singular paper forms, and we can get ahead of it. So that's kind of the precipice of the idea, which then evolved into what we're doing today.
Are you a healthcare professional ready to take the next step in your career? Do you dream of a role where you truly make a difference in a community that's perfect for you and your family? Well then, let me introduce you to Cherry Health. Our platform puts thousands of healthcare opportunities right at your fingertips. Explore jobs by location, specialty, compensation, and more. All on an intuitive map-based platform, available on Android, iOS, or your computer's internet browser. Create your professional profile for free and get started messaging directly with employers. Beyond the app, Cherry Health also offers personalized, white-glove recruiting services who can guide you every step of the way. Your dream healthcare career is just a click or a phone call away. Visit www.cherry.health to start the next phase of your journey.
And so definitely like the financial aspect. I mean, a price tag like that for $80,000, I would say that's probably out of reach for the majority of Canadians right now in terms of, it's probably well worth it, I could imagine, in terms of feeling good and feeling like you're getting your life back. But it's just, for some people, not even a possibility. And so how do you take the price tag out of that sort of much more in-depth team approach and start making that available to everybody? And then at the same time, how do you simplify it, right? Because like you mentioned, right now we've got, I don't know, you use your PHQ-9, you use your GAD-7 screening tool, you use your BEDS-7, you use your ASRS 1.1, right? And so we just have like sort of this collection of individual tools versus I don't know, what if that initial screening that your doctor, your psychologist is running on you is again barking up the wrong tree? Like then what? How do you start actually getting a little bit more diagnostic clarity on things?
Yeah, and how do we? So I don't know. Let's pick ADHD because that was a surprise to me. I mean, I was perfect. I was a 10 out of 10 on the assessment, more on the ADD part. But then when I started to like look into it, then it's like most people with neurodivergent or ASD or ADHD have extreme anxiety. They're certainly predisposed to that because we're just kind of walking through life like shapeshifters trying to fit in. And equally, all the stats based on whatever cohort or age, you have a frightening amount of some sort of self-coping, right? It could be the stimming or substance use or something. So then trauma fits in there somewhere. But again, I don't want to overstep on the science behind it. Okay, so all of these things are connected. But every time I go to the walk-in clinic, I get a SSRI for anxiety, which didn't really work for me like they do now because I'm also doing the other things, cognitive processing therapy and DBT and like all the things. I'm like, okay, well, I'm like 40 something. I don't know how old I am, but in there.
And how, like, when it comes to the technology and the HiBoop platform itself, like, how many different potential diagnoses does it actually start screening for? Or why don't we back up a little bit? Can you give us a bit of an overview of how the technology actually interfaces between the treating team and the patient?
Yeah, so again, we start with the basic screening. It is just a modern application, be it on the individual's phone or the care provider's tablet. Like what we make it really accessible. We're not going to get through it all in one sitting, but we start the pre-screening. So if Jason's coming in or doing whatever it might be, telehealth or something, virtual care. All right, so he's complaining about this thing, and it's not, it's leaning towards maybe some mental health stuff to look at. So what we want to do in that case is to give the individual, so the doctor says, you're going to be here in 5 days. Let's get a head start on this. And we start with the initial screening, and then we connect those constellations to come up with a fairly robust, comprehensive view on the same things that they're going to dig in as well. So on that 5 minutes before I show up, they've already got the preliminary assessment for whatever it might be. And then obviously it's up to the doctor to, potentially diagnose something that is critical, or maybe just watch something that might be ahead of them. So that's basically it. It is questionnaires, DSM and all those other ones that we've imported. So, but the algorithm, which is kind of our IP, to connect those dots based on global research and then eventually our own thing, and then is to get that there as soon as possible. And secondary to that is to follow up. So let's say first responder has singular PTSD, has nightmares every night. Not uncommon. Okay, so we've maybe the doctor said, all right, this is, we're getting to a critical point. It's impacting your life. So we're going to do this thing, CPT and whatever it might be. Okay, so like 6 weeks down the road, what's the outcome? So we prompt the user again, because we already know we've boiled down the things probably not to look at now, and say, how is this? What's the efficacy of this? And it's not grading doctors, it's just tracking it. Maybe it's misdiagnosed, maybe it's this treatment or this pharmaceutical is not working, and then report that back to the care provider and continue that, because as we know, mental health is just a point in time, and we just tend to deal with it when it reaches the critical part.
That unfortunately winds up being the case for so many people. They're like, well, I didn't think I was depressed because I wasn't going to hang myself. But there's a lot of ground in between not depressed and, imminently suicidal.
Yeah, we don't have 11 years in those cases, or it's just kind of sad to have people wander around when there's existing, science that would at least give them clarity, and they've self-diagnosed themselves as borderline, but they're actually bipolar, or like whatever it might be. And we see that time and time again, people just doing, well, this thing makes sense, so I think I am this. Yeah, it's just it's unnecessary. I guess is where I'm going.
Well, and there's just so much overlap too between symptoms and different diagnoses. How does the platform and the algorithm start to sort out, like, even which screenings would be applicable then? Like, let's say patient gets plugged in and they're wondering about depression, but maybe their irritability is coming also from the anxiety. Like how does it start going about figuring out where to look, or does the clinician drive that?
No, I mean, the clinician can opt in or out of, like, if they don't want to do, personality disorders or something, they can at least opt out of that. But the point being is that if you look at the giant, let's just go with the DSM for now, you know, these questions correlate. So you answer, and the beauty, or at least what we're aiming to do, is that the individual does not know what module they're in. They're just asking questions. So we try to remove some bias of people that have already self-diagnosed. So with the initial screening, then we start to work the algorithm to say, let's do a quick check here, and let's kind of eliminate things that we're not going to spend too much time on. And let's drill a little bit more, because the way you answered this question actually also correlates with this, and based on your age and your gender or whatever it might be, we want to look here. Again, it would be what, very good care providers would do. So they don't know what they're in. I mean, if they've from school, they can probably guesstimate if they've been down that academic track. They might know, but what we're doing is asking a set of questions, and the algorithm says, maybe let's go over here a little bit. They don't know where they're just answering questions. And then the point being, after, let's say it's a few days to give people a break, and then we have that initial assessment. And then the doctor can look at all the individual, questions that were answered, and either dispute them or revisit them, and then eventually get to a diagnosis. So it is purposely a product that they don't know where they're at. Like, if I'm like, I have anxiety, I'm going to fill out this form, but we're going to start to move that around a little bit so that we can maybe reach either no conclusion, no preliminary conclusion, or maybe that is something else. I mean, most often usually is, frankly.
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
I mean, I see this quite routinely just in my own practice. It's okay, I think the patient's depressed, so we're going to do the depression screening questionnaire. And the patient doesn't want to be depressed. Obviously, no one wants to be depressed. And so they're sort of resistant of the label. And you can tell, like, just the answers are getting downplayed. They're like, kind of, but I'm going to say 1 out of 4 on this one. Or just like actively, like, knowing which questionnaire they're going through can definitely, like, obscure the answer's validity.
Yeah. And well, this is something I mean, nobody wants labels. Nobody wants that. It just opens up funding and clarity and access to additional help. But, like, what we're kind of trying to prove out in our thesis, again, this is not proven. If I'm sitting across from Jordan and you're asking me these things, maybe I probably would just kind of, like, lower some of the answers, or maybe just increase them wildly. If they're there within, even if it's in your waiting room, on the phone, or before they arrive, there's a good chance they're going to answer more clearly, more honestly, I guess is the word. We don't have evidence on that yet. It is a hypothesis, and they're already seeking help. And if we remove some of those awkward questions with the human, that eventually could help. So The point being is that we think that we might get more accurate preliminary, and then it's obviously up to the doctor to say, I don't believe your answers. I've known you for 10 years. You're not schizophrenic or something. So it was really just removing some of the, what do they call it, white coat?
Yeah, the white coat syndrome.
White coat syndrome. And just allowing them to do it at their own pace. But, again, often it's people would be at sometimes in an inappropriate mindset to even start to do these. But again, it's this point in time, we just track it. We track it along with the care provider.
What about the issue of getting people into the platform in the first place? Like right now, how the clinic that I'm working at is doing it is we'll use our secure email portal and we will send to the patient the individual questionnaires. And I'm going to say we get 5% responses to those. Like it's abysmal. Like it's like not even 1 in 10 people send the thing back filled in. Like how do you guys actually address that?
Yeah, and it's like if we look at like our core metric, I want to go into like the economics of it or the business side of it, is how can we get them through it as quickly as possible. So if it's 5%, well, that's not really doing it. So it is making it really accessible, really easy. That is, they can do it online, they can do it on the phone, they can do it in like smaller chunks that are not as intimidating. With the current, so we're running a pilot with 5 clinics, and some of them are residential or inpatient. Some of them are out broad in the way that they look at things. But part of it is like, this is going to help me help you. And it's not some, PDF you have to fill out. It's like, let's start here. And it's okay if you don't complete the whole thing. So from a product perspective, it's just make this as easy as possible, because you're not going to answer 300 questionnaires. You're barely answering one. So it is to make it a reasonable experience. And part of that is also on the care provider to say, you need to fill this out. You've been here 4 times. Like, do this part. And that goes to the capacity is like, look, we've already got this all done. I need you to do this. And hope most of them do.
And what's been the initial reception like by patients and by the care teams?
So the pilots have just started. And we cut it off. There's some NFPs, smaller ones, there's bigger ones, and depending on that, it's always positive, but it's a different language that we're using with it. Let's say there's a larger clinic that seeks funding, like grants or whatever it might be, to which a lot of them do anyway. There's an increase, especially in like Canada, there's an increasing amount of accountability for those funds to measure. So VHA here in Victoria raises X hundreds of whatever it might be. What we do on the back end is to provide the reporting to say this is working and allow them to tweak it. So we just went through an RFP and they were like, we want reporting. And they're like, we got like a spreadsheet somewhere. But when they brought up our solution, it helped push through that RFP so they could get funding and then report that back without a lot of arduous work and tracking down paper forms and putting them in and stuff. So that is one way to get them excited. The other part of it is, it is capacity based. Again, if I show up 7 times, I'm taking 7 spots. And if we can reduce that, let's say it's an employment wellness program or an insurance provider, whatever it might be, you have 7 sessions or maybe more, whatever it is, free from your employer to get the help, clarity, or whatever it might be that you need. Well, if we can do the preliminary assessment, maybe it doesn't have to be 7 sessions or 12, or maybe it goes to referral quicker. And that's not a hard sell. Like, we care that they care, and it really is not a hard sell for us when it comes to, like, sometimes it's regional stuff or timing, whatever it is, but it really is not an incredibly hard sell at this point because we're just piloting it and proving it out.
Well, I'm excited to see how the pilot goes and the results that are coming in. I think we definitely need more of this kind of technology around. Again, like mental health in general is just such a dilemma right now and underaddressed. And again, like the data that we're getting at my clinic, like it's just so sparse and few and far between. And then you wind up stuck in this like manually laborious cycle of like, okay, well, now we got to spend our whole appointment today literally just going through the screening like one by one. And like I'm looping in the nurses to like call the patients in between and phoning them the week before for extra appointments. And it just like, it's tough. It is very tough, like getting that initial critical data when you have these time constraints. And so hopefully like this can really help bridge that gap.
Well, you can join the pilot.
Okay, we're gonna get in there then. So how does the platform actually work then? Like let's say a clinic is ready to sign up, they're interested. How does this go?
Yeah, so as we kind of lock down the pilot, then eventually it would just be they can sign up, get an onboarding demo, any questions answered around the data security, all those kind of things that are top of mind, or the modules that are used. Then they'll just be able to create a organizational account, and then they can add their practitioners, whatever it might be, to be able to quickly send out a request for an assessment, be it in person or before. And then the back-end system is there to start tracking all of the success. So we can go in and you can go in and look, and what's in progress. Somebody's not even started, and then you can also see critical flags of like, maybe let's get this person in a little sooner because they're scoring something, on the scale in this particular thing that maybe requires a little more attention. So the reporting is important. The tracking obviously is individual. So when somebody shows up, it's right there. It's like a full a full preliminary assessment that says, here's what we didn't look at based on the answers, and here's where you probably could spend some more time to get a diagnosis or not.
And where can people access the tool and the pilot itself right now? Are we all across Canada? Are there any geographic restrictions?
The only one would be Quebec right now because it is a single language application at this point. But we follow all the medical, like we're not storing like health card numbers and that kind of stuff, but we follow the strictest data privacy, HIPAA, all those kind of things. So right now we're just piloting in Canada, but this is a global thing. So we'll eventually, the legalities, as you know, are complicated even provincially. But what we do is we allow the individual to move their data. So let's say you go into a clinic and then you get to reassign it to a new therapist or a new whatever it might be, and then they have and again, it's opt-in, it's up to the individual at that point when they move, or maybe they move countries, to again, accelerate it. Well, here's where I started 6 months ago, here's where I am, and I was referred to you, and instead of starting from the beginning, which you often.
And then I gotta ask, where did the name come from? HiBoop.
Yeah, it's perfect. Everybody asks that. Okay, so it's a term of endearment. I use it with my kids. I just boops them on the nose. And so when we started this, I didn't want it to be like a clinical name. I wanted it to be like, not let's have fun with mental health, but something that was absorbable for people that might, otherwise if it's my clinical health assessments, like whatever it might be. We wanted to, number one, stand out. And it's just a way of checking in on people. So when somebody gets the notification on their phone, it says, HiBoop, we want to ask you a few more questions. So yeah, it's that.
Make it a little more human.
That's the idea, yeah.
Love it. Well, thank you so much for sharing with us today. I don't know, anything else you want to shout out? What's the website where people can find it if they're interested?
Yeah, so it's HiBoop.com. There is a waiting list there, so be it individuals, because there is an end goal of actually just allowing individuals, because they're already doing it, or Dr. Google or whatever it might be. But that's a future state, because we also don't want to just say, here's what we think, and you don't have any resources or whatever it might be. So the individual part will come later, but right now there's a waiting list for both. So if there's clinics that are interested in it, even just learning more or getting a demo or whatever it might be, or signing up kind of on the spot, then we've got a team in place to make that all happen.
Okay, super cool. No, I love that. I think that would be like a great conversation starter to initiate going and seeing the treating team, not only as like an engagement tool from the treating team to the existing patient, but also like a reason to get in there and have a conversation.
Absolutely. And like part of the pilot is, again, like we've got staff members and we've got advisors that helped us craft it in a way that is meaningful to them. But part of that early pilot is really shaping, like, hey, we would love to see this report, or this user flow doesn't work because whatever, our inpatient people don't have access to technology, whatever it might be. So that early pilot, which really just kicked off this month, is to take that feedback, refine the product, and present that back. And then going into next year, it's not that we wouldn't continue to iterate, but that early group has been amazing. Doctors, nurse practitioners, caregivers in general, just to give some light, or bring up something that we didn't fully understand at that point.
Awesome. Okay, well, Jason Morehouse, thank you so much for sharing your story and a little more about HiBoop with us. I really appreciate it.